So let's talk about the impact of the Republican plan here in Wisconsin. Scott Walker was kind of tepid about it.
Tepid, I think, would be an understatement.
Yeah.
He was tepid about it. He also said something striking. He said, well, you know, Obamacare, it's not going to affect a lot of people. You know, if you have a health care plan through your employer, it won't affect you. But, you know, there are hundreds of thousands of people in this state who get their insurance through the exchanges. So it will affect a lot of people in the state, maybe not you or I who have, you know, health insurance from a company or through a company, but it's going to affect quite a few people here. And how this thing shakes out is very important. And what's not being discussed locally probably is Medicaid. You know, Medicaid just doesn't pay for poor people on health care. It also pays, you know, if grandma has to go into a nursing home, it can help defray those costs there too. So it's going to affect a lot of people, regardless of what the governor is saying.
So Paul Ryan today, of course, he has a lot at riding in this and at stake. He was out with his charts and pointers explaining how it's going to work. Dan, what's at risk for him if he can't show, once they have the opportunity to pass this, that they can pass it and then it can actually work?
Well, I mean, he has said, I've got the votes to pass it. So he's put that bar up there, and he says he's going to get through. But the tougher question is getting it through the Senate, as we were just hearing, because there are a number of tough Senate races in 2 years. I think there are 8 Republican Senate seats that are up, but 23 Democratic seats that are up, including Tammy Baldwin. And the debate over the Affordable Care Act and Obamacare, it became a big issue in the Johnson-Feingold race, and I think it'll be another big issue in that race as well. And Baldwin has made it clear that she's going to campaign very much opposed to Trump, and I'm guessing probably in favor of the Affordable Care Act.
Yeah, but for the Republicans, it's kind of a change in position. When Obamacare went through, they could sit back and just try to bollocks it up or not vote for it and watch the Democrats struggle to get the votes.
And
do you
vote
think they're
to
going
repeal it, because they did repeal it.
Do you think they can get the votes? Can they keep themselves unified enough to get it through?
They need to make changes, obviously. What those changes will be, we don't know, but the bill as it stands now is not going to be the version that passes in the Senate. Arkansas Senator Tom Cotton was basically telling the House, slow down. I think that's probably what a lot of Republicans in the Senate are saying, and there's 4 sort of moderate, well, 3 moderate senators and 1 very conservative senator who have deep reservations about this bill. They can pass, again, this is procedural, they can pass a repeal and replace on the money side of it with just 50 votes, but then you have some statutory rules, statutory laws that have to be changed, and that you would need 60 votes. So they're not home free by any measure yet.